internal patch. The first one is sublingual. Sublingual is divided into two types, isosapine dinitrate and nitroglycerin. Nitroglycerin is different from the another one because it can treat acute angina pectoris faster. By the way, Thailand has isosapine dinitrate only one. Sublingual works by releasing the blood vessel and increasing the supply of blood and oxygen to the heart in people who has coronary artery disease. Indications of sublingual are used to relieve an acute angina pectoris attack that is already occurring, or used to prevent an angina chest pain before doing some exercise. Sublingual tablet should be kept in original package, stored in room temperature, kept away from light and moisture, and keep drug out of reach children. Suggestions to use sublingual. The first one, patients who have angina chest pain should sit or lay down. Second, take one tablet in sublingual and let it dissolve by itself. Caution, drug should not be chewed, crushed, or swallowed, and patients should not swallow saliva. Third, patients should have been relieved after taking the first tablet for 5 minutes. If not, patients should take the second tablet. However, if patients are not relieved after taking the second tablet, give them the third tablet and bring them to hospital. Fourth, this sublingual drug is used to relieve an acute angina pectoris attack that is already occurring, or use this drug 5 to 10 minutes before doing some exercise to prevent an angina chest pain. For how to use this drug, one tablet of sublingual is 5 milligrams. Sublingual tablet is used by put one tablet of drug in sublingual or buccal and let it all dissolve by itself. Patients are prohibited to chew, crush, swallow drug and saliva.
Swinghailer. Swinghailer is one applicator of dry powder inhaler. Swinghailer is used for asthma COPD. Indication is bronchodilator. The drug is procaterol. It's beta-2 adrenergic agonist. How to use Swinghailer. Step 1. Open the transparent cover. Step 2. Shake the inhaler up and down for 3 to 4 times. Step 3. Push the button medication is ready to inhale. Step 4. Breathe out and hold without inhaling. Step 5. Inhale quickly and deeply. Step 6. Hold your breath 5 seconds. Step 7. Push the button again to return the inhaler to the unloaded condition. Step 8. Close the cover. If you want to more than one dose has been prescribed, repeal step 2 to 7. Storage. Store medicine at room temperature, away from heat and direct light. Don't freeze medicine unless required by package insert. Keep medicine away from children and pets. Precaution. In case you miss a dose, use it as soon as you notice. If it is close to the time of your next dose, skip the missed dose and resume your dosing schedule. Don't use extra dose to make up for a missed dose. Wash your mouth when you finish to use. Use dry, clean tissue paper or towel to clean the applicator.
Rectal enema. Rectal enigma is an osmotic type laxative, most commonly used for relief constipation. By injection of fluid into the rectum, the solution will reabsorb the water back into the large bowel and stimulate a large bowel movement.
How to use rectal enema. First step, wash your hands. Twist off the cap and lubricate the tube with water or soap or squeeze a drop of the solution out of the tube. Lie on the side and bend the upper leg up to the chest. Slowly insert the neck of the tube into the rectum and gently squeeze out the entire solution into the rectum, then withdraw the tube. Bend the upper leg down and strain the leg together. Tense the anal sphincter for 2 to 3 seconds. Wait patiently till you need to go to a toilet. How to store it. Store at room temperature, away from heat and humidity, and keep away from children. Caution: use only when needed. Should not be used frequently because of risk of an electrolyte imbalance. Dispose carefully to make sure that children, pets, or other people cannot reach it.
Hello everyone. Today I will advise how to use special technique in the medicine. Fentanyl patch. This kit contains about indication, how to apply fentanyl patch, storage, and important warning. The fentanyl patch contains fentanyl, opioid analgesic, and is indicated for the management of pain in opioid tolerance patients, severe enough to require daily, around-the-clock, long-term opioid treatment, and for which alternative treatment options are inadequate. Storage the fentanyl patch at room temperature and away from excess heat and moisture, not in the bathroom. Keep out of sight and reach of children. Important warning: fentanyl patch may be habit-forming, especially with prolonged use. Use the fentanyl patch exactly as directed. Do not apply more patch. Apply the patch more often, or use the patch in a different way than prescribed by your doctor. How to apply fentanyl patch. Step 1. Preparing the skin. Make sure your skin is completely clean, dry, and cool before you put your patch on. Do not use at hairy area. If you must use, you should cut your hairy, don't shave. Don't use at lesion area. Step 2. Open the pouch. Cut off the edge of the pouch completely. Both sides of the open pouch and pull apart. Take the patch out and use it straight away. Inspect the patch for any damage. Step 3. Peel and press. Carefully peel one half of the shiny plastic backing away from center of the patch. Press this sticky part of the patch onto the skin. Remove the other part of the backing and press onto the skin. Hold for at least 30 seconds. Make sure it sticks well, especially the edge. Step 4. Disposing of the patch. Fold it firmly in half so that the sticky side sticks to itself. Push it back in the empty pouch and put the pouch in the bin. Step 5. Wash. Wash your hand after wash with clean water. Step 6. Remove a fentanyl patch after wearing it for 3 days or 72 hours. Do not apply the new patch to the same place as the last one.